and welcome to the National Academies of Practice webinar. This webinar is designed to help guide you through the abstract submission process and to help encourage quality abstract submissions. My name is Tina Haynes, and I am your Vice President for Programming. This webinar has been identified in response to the needs of our NAP membership, identified through a needs assessment conducted in 2017. It is now my pleasure to introduce our panel of speakers. First is Elizabeth Ryder. Beth is a pediatrician and social worker. She is Director of Academic Programs for the Institute for Professionalism and Ethical Practice at Boston Children's Hospital and part of Harvard Medical School. She founded the Boston Children's Hospital HMS Faculty Education Fellowship in Medical Humanism and Professionalism and the Faculty Fellowship for Leaders in Humanistic Interprofessional Education. On the Harvard Medical School faculty, Dr. Ryder has been an invited speaker and consultant in the United States, Canada, the UK, Hong Kong, Taiwan, Poland, Singapore, Australia, and numerous other places. She brings her dual background as a physician and child family therapist to her leadership, teaching, and her clinical roles. Dr. Ryder was inducted as a fellow in the Medicine Academy of National Academies of Practice in 2003. She has held various leadership roles, including chair and co-chair of the Medicine Academy. She is NAP's immediate past vice president for partnerships and networking, and is a Carlton Hobart Senior Fellow of the National Academies of Practice. She is International Advisory Board Chair and founding member of the Institute for Communication and Healthcare in Australia, and she leads the International Charter for Human Values and Healthcare Initiatives, an interprofessional collaborative effort to restore attention to human values in healthcare. Her academic interests include relationship-centered care, values, everyday ethics, communication skills, professionalism, and interprofessional education and curricular development. Beth is an associate editor for patient education and counseling and is lead author of the book, A Practical Guide to Teaching and Assessing the ACGME Core Competencies. So welcome to Beth. Marty Sexton is the Associate Dean of Academic Affairs at the University of Toledo College of Nursing. In addition, she serves the college as chair of the Department of Adult, Family, and Nursing. Family and Population Health and Nursing, and the director of the Learning Resource Center for Interprofessional Education and Simulation. Dr. Sexton has been an active contributor to the College of Nursing for over 25 years, serving in numerous roles related to curricular development and academic affairs. She received her PhD in higher education from UT with a focus on interprofessional education and a particular focus on studying conflict within interprofessional healthcare teams. She continues to speak nationally and publish on the importance of interprofessional collaboration among healthcare teams. In addition, she has played an integral role in the development and implementation of the Interprofessional Approach to Patient Care program, which is offered to over nearly 600 health science students at the University of Toledo annually. And our final panel speaker is Mary Casper. Mary is currently the Corporate Rehabilitation Consultant for Speech-Language Pathology with HCR Manor Care. In her 31 years in the profession, she has focused clinically on swallowing disorders in the geriatric population and communication interventions for individuals with dementia. She has presented as an invited speaker on clinical, regulatory, ethical, and reimbursement topics both within local, state, and national and international venues. She has served in numerous volunteer leadership roles within the American Speech Language Hearing Association, affectionately called ASHA, including the 2017 convention co-chair, and is currently chairing the Scientific and Professional Education Board. She was named a Fellow of ASHA in 2018, has been involved with the National Academies of Practice Professional Development Forum Planning Committee since she became a Fellow in 2015. in the National Academies of Practice Speech Language Academy. She is CE champion and also is currently serving as vice chair. We are honored to have these speakers with us providing this session, and I have the pleasure of now turning the program over to Beth.
Thank you very much. We are delighted to invite you all to submit abstracts for our NAP 2020 annual forum that will be held March 12th through 14th in San Diego. The call for abstracts is now open. We have 4 types of abstracts you can submit: a platform, some of you might know that as an oral, symposium panels, workshops, and posters. The deadline is September 11th. The call for abstracts is now open. The deadline is September 11th. We don't anticipate extending it. You do not have to be a NAP member to submit, so non-members are just as welcome as members. To give you a little bit of detail, the platforms are 15 minutes in length. The symposia, could be a panel, are 45 minutes in length, and workshops are 60 minutes. Each of these time frames will include a time for questions and answers. There is very rich poster session with dedicated time for viewing the posters during the forum. Marty.
Hi. I would now like to provide step-by-step instructions as to how to submit your abstract. First, go to the NAP website at www.nappractice.org. Under the Events tab, hover over Annual Meeting and Forum and then click on Abstract Submission. Read the instructions. Then scroll to the bottom of the page to find the links to the abstract submission forms. Once there, go ahead and fill out the form. Please note, there is a 150-word limit to your session description for educational sessions only, and a 300-word limit for the background rationale, methods methodology, results findings, and conclusions implications. Copy the previously written text of your abstract and simply paste it into the fields. When finished, click the Submit button at the bottom of the page. Please upload completed disclosure forms, bio sketches, and CVs for all individuals planning to present the abstract if accepted.
All right, interprofessional collaboration should be reflected in the authorship of the abstract. We are not going to be considering abstracts that do not clearly represent at least 2 professions. Even if the speakers are from only one discipline, the title of the abstract should definitely demonstrate the interprofessional nature of the presentation. So here's a poor example of a title: How Podiatry Improves Patient Outcomes. A good example of a title might be How Podiatrist, Dietitian, and Physical Therapist Collaboration Improves Patient Outcomes. For learning objectives in your abstract, you want to use measurable terms like explain, describe, review, list, discuss, state, compare and contrast, and not use terms like understand or learn or gain knowledge. The abstract content should reflect one of the forums of the themes. For 2020, there are 2 themes. The first one is called Current Status for Interprofessional Scholarship, Practice, and Advocacy. And as you can see here on the slide, these are submissions in support of scholarship, practice, and/or advocacy work that demonstrates the value, that is, the patient's preference, outcomes, satisfaction, cost effectiveness, process efficiency, reduced readmission to the hospital, and so on, of interprofessional education and/or collaborative practice at all levels, including health systems, federal and state governments, patients, clients, families, caregivers, educators, or researchers. The second theme for the 2020 forum is Emerging and Future Trends for Interprofessional Scholarship, Practice, and Advocacy. And these are submissions that would be in support of emerging and future scholarship, practice and or advocacy, work that is proven in pilot development or in demonstration of non-traditional and potential collaborations or approaches with unique partners and diverse stakeholders, such as policymakers, economists, engineers, and other healthcare providers or professionals that are not currently represented in the 14 FNAP academies. Beth, over to you.
Thank you. So I'm going to first just give you a brief overview of how to get your abstract rejected. Well, first of all, don't read the call for abstracts and don't review the forum title or the topic. Submit an abstract that has no relationship whatsoever to the forum or to the themes. I can't tell you, each year we get abstracts on something quite, obviously they haven't read the title. It might be on cardiac muscles, it might be on spinal cord, this or that, but clearly not something that would have fit for FNAP. So definitely read it. The other ways to get rejected are to have the project or program not interprofessional. The authors will be only from one interprofessional group just to get rejected. The topic is not relevant. A big one is commercial promotion. We do look up, you know, on the internet, some of what you've presented, in your abstract, so we do know if it's commercial. Make it very poorly written, and then a weak methodology or theory base. So that just gives you an idea of what we're not looking for. So now that you know how to get your abstract rejected, this is how you can get your abstract accepted. So, as Mary had said, think about your title, make it descriptive. Your objectives should be measurable in the sense of, you know, when the participant has finished, you know, listening to your oral at the workshop, the participant will be able to then what? Describe, identify, analyze, whatever it is. And this would apply to all the different kinds of abstracts. Your introduction should only include the background relevant to why you did the study. That should be brief. The methods section, describe what you've done. And that is hard to write. Probably that's the hardest one to write. The study design, how it was sampled, what advocacy you were doing it, who your subjects were, so to speak. The results section is really what you found. It may be part of a bigger study, but you want to describe it specifically, the relevant data, the primary outcome. How does that relate to your primary outcome? And the conclusions should be a brief description of the outcome, main outcome of your study, and they need to follow from the rest of the abstract and need to be quite specific. So if you look carefully in the call for abstracts, you will see the different sections. And hopefully that will be helpful to you.
All right, I'm going to talk a little bit about the time frame, the timeline here. The time frame of review and notification of acceptance. So reviews will be conducted this fall by FNAP members. We mentioned already, and I can't say it enough times, the deadline is September 11th, and we've already decided that we will not be extending that deadline. So we want to reinforce that idea with everyone who's viewing our presentation today. So reviews will be conducted in the fall by FNAP members, and scores will be taken into consideration in the abstract subcommittee. The recommended program slate will be put forward to our forum planning committee, and once it's finalized, then notification emails will be sent out to the contact person for each submission. So you can expect to hear back from headquarters regarding acceptance or otherwise in probably the late fall.
I want to give a special thanks to our speakers to remind those who have joined our webinar that other recorded webinars are available. We actually have a YouTube channel, so please do check us out. You'll be able to see the previous interprofessional education collaboration webinars, this one and our future webinars that we have yet to record for you this year. So do check it out. Also wanted to remind you to please, if you haven't seen it already, to save the date for the National Academies of Practice annual meeting and forum excitedly in San Diego. So we hope to see you there. Stay tuned for more information regarding that. You've already heard Mary just remind you again when the deadline is for abstract submission. So September 11th is hard and fast. So please do get your abstract submitted. We look forward to receiving it. And my final statement is simply to say, on behalf of the programming committee and our invited speakers, we want to thank you so much for joining, and have a fabulous rest of your day.